What is epidemiology? When we think of public health, the well-being of the nations of the world, outbreaks and pandemics like coronavirus, HIV/AIDS, prevention and control of disease, and the works of epidemiologists, epidemiology plays a central role. So what is epidemiology? The word epidemiology comes from the Greek words epi meaning upon, demo meaning population, logi meaning study of. In other words, the word epidemiology has its roots in the study of what befalls a population. In general, epidemiology is a study of the distribution and determinants of health-related states or events in specified populations and the application of this study to the control of health problems. From this definition, there are 6 key terms: study, distribution, determinants, health-related states or events, specified population, and application. Let us see each one by one, as there is a foundation for the definition of epidemiology. Study. Epidemiology is a scientific discipline with the sound methods of scientific inquiry at its foundation. Epidemiology is data-driven and relies on a systematic and unbiased approach to the collection, analysis, and interpretation of data. Epidemiology also draws on methods from other scientific fields including biostatistics, economics, informatics, biology, and social sciences. Secondly, epidemiology is a method of causal reasoning based on developing and testing hypotheses. Distribution. Epidemiology is concerned with the frequency and the pattern of health events in a population. Frequency refers not only to the number of health events but also to the relationship of that number to the size of population, in which case the resulting rate allows epidemiologists to compare disease occurrence across different populations. Pattern refers to the occurrence of health-related events by time, place, and person. Place patterns include geographic variation, urban or rural differences, and the location of work sites or schools. Time pattern may be annual, seasonal, weekly, daily, hourly, weekday versus weekend, or any other breakdown of time that may influence disease or injury occurrence. Personal pattern or characteristics include demographic factors which may be related to risk of illness, injury, or disabilities such as age, sex, marital status, socioeconomic status, as well as behaviors and environmental exposures. So characterizing health events by time, place, and person are the activities of descriptive epidemiology. Determinants. Determinants are the causes and other factors that influence the occurrence of disease and other health-related events. Epidemiologists assume that illness does not occur randomly in a population, but happens when the right accumulation of risk factors or determinants exists in an individual. To search for these determinants, epidemiologists use analytic epidemiology or epidemiological studies to provide the why and the how of such events. They assess whether groups with different rates of disease differ in their demographic characteristics, genetic or immunologic makeup, behaviors, environmental exposures, or other potential risk factors. Health-related states or events. Epidemiology was originally focused exclusively on epidemics of communicable disease, but was subsequently expanded to address endemic communicable disease and non-communicable diseases. By the end of the 20th century, additional epidemiological methods had been developed and applied to injuries, chronic diseases, maternal and child health, environmental health, and occupational health. Then the epidemiologists began to look at behaviors related to health and well-being, such as the amount of exercise and seat belt use. Specified population. Although epidemiologists and direct healthcare providers or clinicians are both concerned with occurrence and control of disease, they greatly differ in how they view the patient. The clinician is concerned about the health of an individual, and the epidemiologist is concerned about the collective health of the people in a community or a population. In other words, the clinician's patient is the individual and the epidemiologist's patient is the community. Therefore, the clinician and the epidemiologist have different responsibilities when faced with a person with illness. For example, when a patient with diarrheal disease presents, both are interested in establishing the correct diagnosis. However, while the clinician usually focuses on treating and caring for the individual, the epidemiologists focus on identifying the exposure or source that caused the illness. the number of other persons who may have been similarly exposed, the potential for further spread in the community, and the interventions to prevent additional cases or recurrences. Application. Epidemiology is not just a study of health in a population. It also involves applying the knowledge gained by the studies to the community-based practice. Like the practice of medicine, the practice of epidemiology is both a science and an art. To make the proper diagnosis and prescribe appropriate treatment for the patient, the clinician combines medical or scientific knowledge with experience, clinical judgment, and understanding of the patient. Similarly, the epidemiologist uses a scientific method of descriptive and analytic epidemiology, as well as experience, epidemiologic judgment, and understanding of local conditions in diagnosing the health of the community and proposing appropriate practical and acceptable public health interventions to control and prevent disease in the community.